Hi.
Hi. So my name is Jamie Rogers, and I am a student at YSU in the Family Nurse Practitioner program right now. And I want to thank you first off for meeting with me today. So the purpose of this meeting is to just explore the lived-in experience of a current APRN and try and understand the influence of advanced practice roles in today's healthcare, and then maybe identify some barriers and opportunities for growth within the profession. So this should be a really brief meeting, approximately 5 minutes, if you have a moment to share some of your thoughts.
Sure.
So can you start out by sharing your name and specialty?
Yeah, so my name is Brandon Rogers. I'm a nurse practitioner in the emergency department. I've been a nurse practitioner since 2023, so 2 years now. I started out as a nurse back in 2011, and I worked 10 years in the ICU and then moved to the emergency department while I was in nurse practitioner school and got my NP and then went straight into the emergency department from there.
So thank you for sharing that brief overview of your nursing journey. What inspired you to become an APRN?
So I initially started out wanting to go as go into nurse anesthetist career back in 2008 or 9 when I was young. And once I got into nursing, I decided I don't want to be on call when I'm not at work. And so I decided, well, I don't want to do CRNA. You'll be stuck in the emergency or in the OR all the time. You'll be called in all the time. Mm-hmm. And so I decided that I just wanted to get my NP and have a little more autonomy as well as not being on call.
Okay. And your position is currently in the emergency department right now. And what is your scope of practice like? What kind of populations do you take care of? Are there any specialty procedures that you're able to perform?
Sure. So I'm a family nurse practitioner, so I see all age ranges from birth to death. And in the emergency department, I do all kinds of procedures. I do, incision and drainage of abscesses. I do suturing for lacerations. I do central lines for patients that are really sick. I do intubations when they can't breathe on their own. I've done temporary transvenous pacemakers for patients that need pacing.
Yeah, that's definitely the skill set. Yeah. Wow. And your collaboration in the emergency department, who do you have to collaborate with on a day-to-day basis?
Day-to-day, I docs, emergency room doctors. There's always a physician in the department with us as nurse practitioners or physician assistants. I'm the only NP currently in the emergency department. We've got 2 other PAs.
Okay. And then you obviously speak to or consult with quite a few other different specialists as well.
Oh, absolutely. I mean, from everything. So ear, nose, throat doctors to cardiologists, sure, to neurosurgeons to general surgeons to orthopedics to everything.
So going a little bit further, what kind of influence do you think APRNs have in today's healthcare system? So how do you feel like nurse practitioners improve care for patients?
Well, nurse practitioners bridge the gap because ultimately, without nurse practitioners, we would be so short on physicians that people would not get the care that they need or even want.
Absolutely. Yeah, I can definitely see how APRNs can not only improve access, but quality and efficiency of care as well. So especially in the emergency room, it probably helps with bottlenecking of patients and whatnot. So moving in on this, do you feel like there's any barriers that nurse practitioners face in today's healthcare field?
Oh, absolutely. I mean, the scope of practice is huge, right? So everything goes through an emergency room doctor. Given where I work, I'm fairly blessed, but I mean, it's you have to have a lot of oversight, and that oversight sometimes isn't always needed, especially when you're dealing with very simple things.
Sure.
Something is like an inch laceration on a hand doesn't need a doctor to come in and look at it, right? I mean, a nurse could ultimately probably take care of it, but
sure,
nurse practitioners having that ultimately taking care of the gap that the physicians can't make it to in the emergency department is huge, because physicians are so tied down with really, really sick people, and ultimately all the people that come in with dog bites or simple lacerations or the sniffles will sit there for hours and hours. I mean, if you go into a big city, there's sometimes waits of 12 to 24 hours in an emergency department, and it's very, very poor for most of our communities to be seen.
Do you notice any like reimbursement issues or credentialing issues that nurse practitioners might face, or even APPs?
Credentialing for me, it took months to be credentialed. Once you get credentialing, you're kind of set. But moving from job to job, if you want to move from one spot to another, you have to plan ahead.
Sure, there's inconsistencies in that process, and I'm sure
for them to say, sure, you can do this, even though you've been doing it.
Yeah.
It takes 3 months for that.
You probably don't notice as much of reimbursement issues being in the emergency room versus probably like a primary care setting, I would say, for billing, and it's probably not something you're too familiar with. I'm just making an assumption here, though. Okay. So what kind of desired changes would you hope for the profession?
Ultimately, full practice authority,
Sure.
right? I mean, they've been trying to push that bill in Michigan for years, and we're still sitting here waiting for it to go through. But full practice authority would change a lot. There's a lot of things that we could do to help out, and we're sitting here with our, twiddling our thumbs.
Legislation or policy reform definitely would benefit this profession. And then, do you notice any issues with respect or recognition?
Oh, absolutely. I mean, I've talked to emergency room doctors that have worked in all kinds of practice settings, and they've seen inconsistencies between physician assistants and nurse practitioners, but that's in any specialty, right? I mean, so emergency room doctors themselves, I have experienced multiple locum doctors that have come up and have been just as bad as any nurse practitioner I've ever seen.
Yeah.
So, I mean, ultimately, it really comes down to people, and nurse practitioners can be just as good as doctors depending on their experience. So,
improvements in compensations, autonomy, and even career advancements.
Compensation will never be probably equal, but as far as autonomy, I definitely think there's room for improvement. So.
Sure. Well, that wraps up this interview portion for now. I sincerely appreciate you taking the time to meet with me and share with me some of your thoughts and experiences. Honestly, your contribution is incredibly, insightful for me as a future APRN myself and as a student. So thank you very much.
Absolutely.
Yeah.
Nice to meet you.